This is your host, Mr. Silwamba. As of today, I want to do a very, very important procedure, which is tracheostomy care. So before we start the actual procedure, there are a few things that I would like to show you about the tracheostomy tube and the suction machine. So at the moment, we'd like to talk about the suction tube and also the tracheostomy tube. Okay, so that at least you relate these two tubes, the suction tube, the tracheostomy tube, how they're going to work. At least we start with the tracheostomy tube. Okay, so the tracheostomy tube has got parts. So let me just spread it over here so that at least you see what I mean. So if you look at this, I will start with the simplest. These are straps, okay? The straps, so that we tie round the neck of the patient. Then from there, from the straps, we go to this long string-like, okay? So this part, it's an introducer, and then this is a pilot balloon, because here we're going to connect your syringe like that, and then you're going to introduce air into the pilot balloon. Then air will flow in this tube and then go and inflate the cuff. So let me just demonstrate how air will flow from the pilot balloon through this small tube to the cuff here. So this is called a cuff. So we're supposed to draw air, at least 10 mils, and then connect there and then start pumping. As you can see, the pilot balloon is being inflated as well as the cuff is being inflated. So as you push further, you see that everything is inflated, both the pilot balloon as well as the cuff. So this cuff is there in the trachea. When it's in the trachea, it will be able to at least occlude any substances to fall down the trachea, as well as to give support to the tracheostomy tube. So that's what it does. Then apart from this, we've got this part here. They are flaps, okay? These are flaps, but you can call them first plate. First plates, or this one is a first plate, this one's a first plate. So first plates, okay? Or some call them wings. That's what they do. Then sometimes you'd find that they've got holes here around the tracheostomy end here. Sometimes you may find holes. Those are called fenestrations, or this is a fenestration, meaning just a hole. So that's what it's called, a fenestration. So that will allow air to go in the trachea and then go down the airway from the outside environment to the airway. Then this is a shaft, okay? So it's a shaft of a tracheostomy tube. So meaning those are the parts at least you need to know. So I've got the straps, pilot balloon, then the connector end, then the distal end, the one which goes into the trachea, then we've got the shaft, we've got the cuff. So those are the parts, okay? So at this moment, let me just try also to orient you to the suction machine. As you can see, it's supposed to be connected to power. So the power cable is here, it's right behind. Okay, this is the power cable. It's connected to power there, and it's on, it's live. So this is the power cable. Then this part here, right behind, it's the pedal. So this is where you step in case it's an option. It's a pedal where you step if you want to make it suck the secretions. So it's an option where you step. You can either use the pedal, which is here, or you can go right on top there. Okay, so let's just ensure that you need to connect it. Just ensure that there's power. Yes, so the green light there is an indicator to say there is power. So if you want to step on the pedal, which is right there, you can step on it, then the yellow light will show, meaning it's running, it's on. Then you can do that and suction. Okay, so that's the beauty about it. Another part, if you're not using the pedal, you have to go to the button itself. The button has got off and on. Okay, so you can go to on there, meaning the yellow light will show running. So meaning it's on. Then you can switch off from there. So it's got two options there. Then if you look at this other part here, this is a pressure regulator. Okay, pressure regulator. So pressure regulator is the one that you use to set which pressure you want for you to suction. So for example, if you are suctioning the airway, you can set it here. Say this one is MPa, that's the SI unit, MPa. So you can set it from 0 to 20, which is there. So which is 0 to 0.02, somewhere there. If you're using something in millimeters of mercury, you can set it from 0 to 20 millimeters of mercury. Now this is a MPa, so you go from 0 to 0.02. So you can set this using the pressure regulator. Okay, then what about if you want to check if the suction machine is working and what pressure is the suction machine at? So if you want to check the pressure which is there on the suction machine, switch it on and then occlude with your palm like that. Then check on the pressure there, on the pressure gauge. Just check the gauge and see how far it's going. So meaning this has got pressure, it's working. Okay, then let go. So meaning you have tested the suction machine is working. At least it's able to get and adapt to that pressure. Okay, so you can switch it off again. Then if you look in front, we've got two bottles here. These two bottles, this bottle here, it's to give you the pressure for you to suck, and then this other bottle is allowing you to hold on to the secretions. It's the one that gets the secretions from the patient. So all the secretions from the patient will come through the tube to this bottle. Then you've got a filter here. This is an air filter because there's air which will build up in this bottle. So that air has to be filtered from the machine to the bottle, then to the bottle to this other bottle. And then there's that mechanism which works out there. Okay. So just know that this bottle, this is where the secretions will come, okay? And this is for pressure. Okay, so now let's move on to the trolley now. We see what's for us there. So the procedure now begins later after knowing what we have here, okay? So let's have now the top shelf. On the top shelf, we've got hand towel. So this is the hand towel. It will be used for drying hands after scrubbing. Then we've got this drape here. It will be used for draping the patient as we do the procedure. We've got a galley pot with gauze. So gauze will be used for cleaning. You see how we're going to use it. There will be a way in which we use it. You'll be able to see. Then these two galley pots will be for normal saline. We have to pour normal saline there for suctioning as well as for cleaning the surrounding area for the tracheostomy. Then we've got sterile gloves. Sterile gloves will be used because this is a sterile procedure. Okay. Then we have a receiver. This receiver will be used for pre-squeezed swabs as well as to hold the normal saline which will be able to drop in the patient's trachea. You'll be able to see we've got normal saline in that syringe. Then the bottom shelf, we have this receiver with a solution. So this solution is called sodium bicarbonate. So sodium bicarbonate will be used to discard the suctioning catheter after we use it on the patient. This is what we're going to discard. Okay. Then we've got another receiver. This receiver is empty, so we're going to discard the used swabs in this receiver. Then the bowl here, it's here to receive the drape as well as the hand towel after use. Then we've got an incontinent sheet. Incontinent sheet will be to be spread on the patient's chest so that we don't mess up the chest as we do the procedure. We've got Vaseline gauze. Vaseline gauze here will be used to put under the flaps. Or remember, we said it's got the tracheostomy tube has got wings, so we're going to place Vaseline gauze under the flaps or under the wings. Okay, so that's after cleaning or after doing the procedure. So alternatively, if we do not have Vaseline gauze, if we don't have it, we can use Vaseline. But then Vaseline moves with a spatula so that at least your assistant can scoop and use a gauze and spread just around the flaps or around the tracheostomy tube. Then we have the tube itself. The tube comes sealed, okay? So it comes sealed, it's got parts, okay? You'll be able to see that there's this part here for occluding. So the tube comes with this part, you occlude there, or if it doesn't come with this part for occluding, you can use your thumb to occlude, or if there is nothing like this, you can be able to kink the tube when going in the patient tube. Be able to see the technique we use. Okay, you can kink it or you can occlude. Okay, so you see how we use such. Lastly, we have normal saline. So normal saline is the solution of choice when doing this procedure. You will see how we're going to use normal saline. So at this moment, now we can do the procedure. Then those who are doing OSC, you'll be able to do this procedure in 5 minutes. So you'll find that this trolley is set like that. Meaning, if everything is set for you like that, there's just a few things for you to do. And those few things is to show the examiner the technique of suctioning. So you should know how to suction, and that's what we want to demonstrate this moment. Okay? So before you begin everything, touching there, you need to don gloves and obviously inspect where you want to do the procedure. Okay? So, but at this moment, we're not going to don gloves as we do the procedure because we don't want to bring that complication in OSCE. Okay? Where you examine with gloves. Okay, we'll just go straight. So let's start the procedure. First thing, hand washing. So hand washing in OSCE is brisk, it's fast, so you just have to do it fast so that you do other things. Okay, right. And you go to Mr. Moa. So good afternoon, Mr. Moa. Good afternoon, Mr. Moa. I would like to come and help clean the tracheostomy tube. So in cleaning the tracheostomy tube, we're supposed to introduce a tube called the suction tube in this tube so that we suction. So the procedure is somehow uncomfortable, so you have to cooperate with us so that we clean the tube. So this is the tracheostomy tube in situ. So we should come with suction catheter to remove the secretions which are inside the tracheostomy tube. So Mr. Moore is going to at least cooperate with us so that we remove the secretions, because secretions will not allow him to breathe properly. Okay, so that's why we want to remove the secretions. So at this moment, he has allowed me, I can go and prepare. Yes, I get this tube and open it there. So this is a tracheostomy tube, sorry, suction tube, which will go in the tracheostomy tube. So you get it and then connect it to the suction tube there. Okay, you connect it like that. Okay, so don't remove it completely, just connect there, but leave it in this plastic here like this. So it's supposed to be just there. So this is very important because this is what you earn marks when you're doing OSCE. So leave it there and hang it there. Okay, but then another very important point, though we tested the suction machine before we started, we tested it. But then when you are connecting, you should also try to switch it on and off so that you're sure it's on or it's off. Okay, just like that. So meaning you can hear even the sound and you can feel that it's about to produce air. Okay, so it's working. Then you can switch it off and leave this active. Okay, so you can leave there that tube just there, so that at least when you come back it's easy for you to get it. Then another bit that you're going to do is you're going to do this procedure, making the patient in a sitting up position. So you should get a backrest, or if there are pillows, you should get pillows so that the patient is in a sitting up position. So let's have Mr. Mua to be in a sitting up position. So Mr. Mua, can you kindly sit up? Okay, so Mr. Mua is sitting up. So the backrest is there. Can you see? Okay. So this is a very good and important position, so that at least even as you suction, the patient is comfortable. Okay. So you make the patient sit up. So the first thing that you did here, you tested the suction machine, you connected the suction catheter to the suction machine, and then you have made the patient to sit up. Then the other thing that you have to do is to get this incontinence sheet. So incontinence sheet should be spread over, right, so that you don't soil his clothes or linen. Okay. Just place it over like that, and then from there you have to go back to your trolley. So you have to go behind because you work from behind. This is what you do. You have to go behind and pour normal saline like that. Okay, so you can utilize only one receiver, but then if you're soaking your swabs, you need to also pour in this one, so that at least you have two receivers with normal saline. This other receiver, this is what we're going to be dipping our suction catheter. So then this one is for soaking our swabs. This other gully pot for suctioning, okay, to help us in terms of suctioning. So let's go now to see what else we can do. Okay, so at this moment, you have connected the suction tube, okay, there, it's ready, and the suction machine is working. The patient is propped up with an incontinence sheet. Then you have also poured solutions there, as well as you have made sure that the environment is okay. So then the next thing is for you now to scrub. Okay, so the scrubbing, you refer to our previous sessions, but again I'll just quickly scrub. Okay, to our previous session for scrubbing. You go in like that, okay, then get soap.
Oh, out of the skin.
Okay. So you put good lather there, then you do that, then you start, okay, to go that, okay, to go, then you go. Then my assistant to close the tap. So now you're supposed to come to your trolley, well scrubbed. Then you pick up the towel for drying. Just pick it up like that. Okay, so it's got 4 corners as usual, which we did previously. So you get it. Then start from the fingertips as usual. Okay, then you dry another corner, you go around, then you go outside. Okay. You go round, 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 round. Then another corner, which is the next, this one, you go inside. Okay, so the last corner, you go outside. So refer to the previous session also, you'll find this information. After you're done, you hold it, then you throw it in that bowl. Okay, so it has gone in. The next step is for you to glove up. You need to come here, you spread like that, then you get your gloves. So the technique still remains, no need of touching this part, just have to go in there. Okay, that. Then even this part, you grab, then you go in like that. So as you practice, you find that the technique for blabbing becomes simpler. So it's very easy to blabber, but you just need to follow those techniques. So have to practice and make the technique very simple. So again, after you're done, you go in the middle, you grab it there, and then drop it there. Okay. So at this moment, I need to prepare the swabs. I need to get one swab at a time. So the solution for suctioning will be here. I've separated it. This will be used for suctioning. Then this is where I will dip my swabs. So this will be for covering on top. So I have to set it aside. Another one, I have to put it there. So this one will be for wiping the suction catheter. It will be here. Then at this moment, I need to drape. So I have to get the drape, hold it like that. Okay, and then go the same technique, just like that. Okay, then you leave it. Okay, so meaning you have also draped. Need to drape the patient. After having done that, we've got this syringe with a little bit of normal saline. So to just soften the secretions, go at least drop 2 drops of normal saline. So 2 drops, 1. So you're going to just like that. So you can just see, but at least it has to be on top like that. It shouldn't touch anywhere. Just like that. You just drop just about 2 drops. Then afterwards you can discard this. Okay? You can discard it down there. So at this moment, this is the most crucial part. Then you have to just think about your hands. Which hand should you take down there to switch on the machine? So the preferred hand to switch on the machine, which will become also unsterile, is the left hand. So this hand will become unsterile, so then just use it to switch on the machine. So I have to go down there and switch on. Then at this moment, I ask my assistant kindly come and help me. So the machine is on, then I have to grab this tube here. After having done that, then my assistant will have to pull the plastic out, okay, like that, but I have to be careful to grab this, at least it shouldn't touch anywhere. Okay, so this is how we get it. Then I have to go to the sterile fluid. Then this hand is no longer sterile, but as you can see here, you can either occlude using this, or you can use your hand to occlude. Or some people will kink. Okay. Some people will kink here when going in. Some people will just occlude. Okay. So now let's see if it's suctioning. Like this, it can't suction because my hand is off. My finger is off this hole here. Okay. So this valve is supposed to be on and off. So my finger is there. So meaning it's suctioning. So this is suctioning. So I have to now get my gauze there. So this gauze has to come here, at least approximating 15 to 20 centimeters. So this length of this tube is the one that will go in the patient. So 15 to 20 centimeters. Then I have to go to the patient. The technique is that when going in, I have to go in while the valve is open here. The valve has to be open when going in. So I have to let go. My thumb has to be out. Then I go in just straight until I meet resistance, and at least I've reached 15 to 20. Then when coming out, the valve has to be closed. This valve has to be occluded. You can use this to occlude, or you can use your thumb. You can choose which one, this or your thumb. So I will use my thumb to occlude there. Then when coming out, I have to come out in a circular motion like that. Circular motion. So I have to come out in a circular motion. When I'm out, I need to wipe there, then come here. Okay. This I can discard and pick another one. Okay. Then since there are secretions in this tube, I have to put it there. I have to occlude the tube there again. The tube has to be occluded again, so that when you occlude, then you suck, just to clear out the secretion. So you can do this as many times as possible. So as for me, we'll do it just twice. So you go in again, straight, with the valve open, then occlude when coming out, and start in a circular motion like that. When I'm out, I have to clean, and then also clean there. So meaning you can do at least maybe 3 times, okay, without irritating the patient. So you can do it maybe 3 times or 4 times, but without irritating the patient, okay. So you can see if the patient is comfortable or not comfortable. So you can assess, and you can see if the airway is clear or not clear. You can just even see the way the breathing sounds are, or you can just assess from the way the patient is appearing, okay. So after having done that, what will make me stop suctioning is I've thought of it, say, and I've seen to say there are no more secretions. At least I've gone maybe 3 times or 4 times, and there are no more secretions, and the patient is comfortable. There are no, maybe say breathing, the breathing sounds are not there. Say what I mean is maybe say stridor, and there's no wheeze, there's no stridor. So at least the breathing is, or the breath sounds are clear, okay. There's no noise. So you can even check, is the patient comfortable? So there are no secretions. Is the chest congested? No, it's not congested. So at least you can assess. Okay, so after having suctioned, you can throw this gauze there, and then get this, and okay, you can place it there to cover. Okay, so it's a light gauze, so you can place it there so that it acts as a filter. So this will act as a filter. Okay, you can place it there. It's light gauze and it's a filter, so that the patient will breathe moisturized air. So this is a wet gauze, so the patient will be able to breathe moisturized air. Thereafter, now you can switch off the machine. Okay, so you can just switch off the machine there. The machine is off, and then you can get this tube here. You disconnect. So after having disconnected the tube, it has to go into sodium bicarbonate. So this one goes into sodium bicarbonate like that. Okay, it has to be immersed there. At this moment, then I'll ask my assistant to give me Vaseline gauze. Okay, so the techniques are 2. We're going to use 2 techniques, either for using of Vaseline gauze, or to just use ordinary Vaseline in case you don't have Vaseline gauze. So I will get Vaseline gauze from my assistant, since we're using Vaseline gauze. Okay, so I will get it from there. That. Okay, so this is Vaseline gauze. For those of you in foundation, so this is how Vaseline gauze looks like. So it's covered in, I say, in between 2 plastics, this and that. So this is Vaseline gauze. So you just have to peel off and get it from there. Okay, so you can get it from there and then make something like this. Okay, and then just there under, you can place it there just to prevent skin excoriation. So you can go down there, okay, like that. So you can go under the face plates or the flaps, or you can call them the wings. You can go down there so that at least, so it will be like that, to appear like that. Have you seen? So this is how it goes. Okay, so you can leave it. So this is acting as a filter. So after having done that, I have to also remove this. I take it back there. Also the incontinence sheets has to be out. Okay, so Mr. Mwewa, if you feel any discomfort, call on us, as well as if you feel any air around your neck, it may mean that you have subcutaneous emphysema, so you need to call us. And it can also be an indication to say the tracheostomy tube is dislodged, so you need to call us so that we check promptly. And then if you're not breathing well, maybe in a lying position, you can call on us as well. We can just try to see how we can place you in a comfortable position. So it doesn't mean that if you have the tracheostomy tube, you cannot eat. So Mr. Mola, you have to eat, and the foods you have to eat are those available. So in this hospital, we've got beans, which is a protein. It helps in healing. And then we've got ushima, which helps also in giving or boosting your energy. So try to eat as much so that at least you can get better. Okay, thank you very much for allowing me to do the procedure. Okay. So this is how we should carry out tracheostomy care. So for any questions and any contributions, you can post. There's that comment option, so you can ask on the comment options. Then there we can get back to you. Any of us teachers will get there and respond to your questions. And if you have any contributions, just comment on the comment section. We can see them and we can respond. Thank you very much. Watching.